This is Patricia Walter, and I'm interviewing Dr. Mont in Baltimore, Maryland, about hip resurfacing. Hello, Dr. Mont.
Hi.
How many hip resurfacings approximately have you done to date?
Probably close to 2,100.
And what resurfacing devices do you normally use?
I've used all the different resurfacing devices that are on the market, some in an off-label fashion as well. I actually care more about how you put them in, the surgical technique, rather than the specific device. From a patient point of view, I think if you're looking at these different devices, you're not going to see terrible differences between each of them, and I would actually believe that you should get close to, in the correctly selected patient, you should probably expect to get 99% or so success rates at 10 years with any of the devices. So I'm not somebody that tries to advocate one device or the other. Specifically, the ones that I've been using more often now are the Right Medical and the Core Med, but I've used the Birmingham. A lot of times a patient wants to use the DePuy device. Often a patient wants a device, so I will give it to them, but I care more about how you put them in.
Could you tell us what surgical approach you normally would use or prefer?
It's another question where I think that I've used almost every approach that has been used for resurfacing, and I think that you should select a surgeon for what they feel comfortable with in terms of approaches. I most often have used an anterolateral approach, but I've certainly done over 100 posterior approaches. I'm now working and as per patient request, doing straight anterior approaches. What I will say is there are a number of studies that are showing absolutely no differences in the clinical outcome of any of those approaches. Whether you're talking about a standard total hip replacement or resurfacing. I can talk for another 20 minutes on various advantages and disadvantages of each of those approaches, but I think, and I tend to think patients spend a tremendous amount of time with that. And if you actually go to your site and to other sites, you'll see whole lists of reasons why to use one approach or the other. Some of them you may trade a short-term gain for a loss in the long term, so you have to consider that you might get a very fast recovery maybe with one approach, but then you might lose in the long term, which you got to be careful with.
Hip resurfacing obviously is becoming more popular, hopefully becoming more supported by the medical community. What do you see as the current trends going to happen in hip resurfacing?
Well, in the United States, up until 2 years ago, there were way less than 1% of the hip replacements were resurfacings. Now we're probably getting into 1 or 2 or so percent, and in most countries where it has been introduced, it nestles at about between 5 and 10% of the hip replacements. It doesn't typically go higher than that. There are certain surgeons like myself that will do more, but that's just because a lot of patients that want a resurfacing may gravitate. I think that is leading into a comment that it's a bit more complicated than a regular standard hip replacements, and it'll be done by surgeons that really do want to specifically learn the techniques that allow for success for resurfacing. So it'll continue to grow, but it'll grow for a specific group of surgeons that take a tremendous interest in it. And for example, you might have 5 surgeons in a group that do a lot of hip replacements from a hospital. It would probably be better that one of the surgeons does the resurfacings and takes a tremendous interest, and then the other 4 surgeons are doing standard hip replacements, and I think that's how things may evolve.
There's been some talk about metal ion levels after hip resurfacing. Should a patient be concerned about high metal ions?
Well, I mention it to everybody. I have a standard way that I approach the advantages and disadvantages of resurfacing, which we can talk about now if you'd like, as another question. It takes a few minutes. But I do mention that patients after a hip resurfacing or any metal-on-metal device will have slightly increased metal ions post-operatively and up to 1 year after the surgery. The good news on resurfacing is that of the studies that have been published and the ones where I know that people are following these patients, where they're taking these metal ions out to about 7 or 8 or 9 years, they're actually not increasing, and the average is actually decreasing. So that's some of the good news. I don't think anybody really has an answer one way or the other for the metal ion issues. I certainly have not been seeing any problems. There are studies that show, there's even a study from the Mayo Clinic where they looked at 15,000 and 20,000 hip replacements, and they showed lower risks for things like cancer with patients with metal prostheses versus standard prostheses. There are some patient populations that you have to really be concerned with metal ions. For example, patients with renal disease who do not process heavy metals should not get a resurfacing or a metal-on-metal device. Obviously, a patient who has an allergy to metal. Some allergies are very minor, that may not be a contraindication, but people with really known hypersensitive reactions, I would say, is not a good indication. I'm not a big fan also of patients of young women that want to become pregnant, because there is some data that shows that the metal ions do pass the blood placental barrier. We don't know what that may have, although in our study, our FDA study, there of about 1,800 resurfacings done for the Conserve Plus Right medical device. There were about a woman implanted. There were about 12 babies that were born to women that had resurfacing devices. Obviously, after they finish their surgery, you don't do this device on pregnant women, if that's what you're thinking. And all those babies had no problem. That's a little tidbit. It may not mean that much.
Is there anything special you would like to share with a prospective patient about your hip resurfacing experience?
I believe my resurfacing experience has been very special. I went from a state where the patients were doing incredibly well, from how they were performing, functioning, their walking, their activities, and that was very special, and that got through. My opposite special part of my initial experience was a lot of problems with learning curve. We had fractures in the early rate. Everybody that wanted a resurfacing, we were giving it to them because they had waited 2 or 3 years. We've now learned how to, it used to take me 2 to 3 hours to do these cases. We've now learned, now we can do the cases in under 1 hour. I can do that. It's very satisfying that way. I think that reduces problems. The complication rates, which used to be fairly high, should be way under 1% now. And I think that is, for many of the surgeons that are taking an interest in this, should have very low complication rates. And we've, in general, the surgeons that are doing a lot of these cases in America are doing very well. The other thing that is actually nice, which takes time to be able to say this, is when I used to talk about some of the disadvantages, it was, this is just a new technology. But now we're getting close to a decade of use. And the patients getting close, for me, they're at the 9-year point. They're actually doing very well. So I can tell a patient who I'm perhaps talking to with this video that you'll always know how patients 8 or 9 years ahead of you are doing. That's a lot nicer than going into an unknown field where you don't know that. I'm very happy with that. We know a lot more about the indications, when to do procedures and when to back off and not to do these in certain patients. That's a pretty good thing to know. We know a lot more about the surgery, what to avoid. A surgeon having trouble can always back off to a total hip replacement. That they need to be able to do that and have the gumption to do that, or the knowledge to do that. So I believe we're making this a safer procedure, better indications. It's a nice technology. I'm happy with the results. I have countless very fortunate patients that have this technology.
Well, thank you very much for taking time to do this interview.
Thank you, Pat, and thank you for all the work you've done as a patient advocate over many years, and for this whole field, as well as the field for any hip replacement in general.